Dr. Shilpashree, consultant obstetrician and gynecologist practicing in South Bangalore. Today I'll be talking about the most commonest symptoms or the most commonest problem which we all women face at least once in lifetime. That is nothing but vaginal infections. Vaginal infections, also called as vaginitis, it can be an infection or a simple inflammation of the vaginal tissue. Vulvovaginitis, which is a combination of infection or an inflammation both of vulva and vagina. Vulva is nothing but the opening or the doors of vagina. So, first let me discuss what is a normal vaginal discharge. A normal vaginal discharge we all women have. This is very much common because of the hormonal changes which happens throughout a cycle. Usually a woman secretes estrogen hormone in the first half of a cycle and then comes the progesterone hormones. Usually during the ovulation the secretions increases. So this is very much common. A thin, a non-smelly, non-itchy vaginal discharge is very much normal. So now we know what is a normal vaginal discharge. Some deviation from this normal vaginal discharge, which can be a change in the color of the vaginal discharge, and also a change in the amount of vaginal discharge, a smelly vaginal discharge, a vaginal discharge associated with a vaginal rash, a vaginal discharge causing discomfort while passing urine, making the sexual intercourse difficulty, or associated with burning symptoms following a sexual intercourse, or a burning symptom after urination, can all be abnormal vaginal discharges. So these are the most commonest symptoms what a woman says when she has been suffering from an abnormal vaginal discharge. So let us know who are these women who will be more prone for this vaginal infections. Firstly, the woman with a more than one sexual partner is more prone for vaginal infections. The other condition, when she is obese or when she has been suffering with PCOS, a lot of estrogen is being secreted. This can lead to excess vaginal discharge and can attract bacterial or fungal or trichomonas infections. So these are the most commonest conditions in which a woman faces vaginal infections. Last but not the least, even a menopausal lady, because what happens is usually for a woman after 35 years, the women-friendly hormone, which is estrogen, starts declining. So it leads to loss of elasticity in the muscles. So when there is loss of elasticity, obviously there will be vaginal tightening, the dryness of the vaginal skin or the dryness of the vaginal mucosa. Whenever there is dryness, it leads to irritation. Irritation again leads to infections, rash, anything she can present with. So usually a woman in the perimenopausal age or above 35 are also more prone for this vaginal infection. The other medical conditions which leads to this vaginal infections are diabetes. As we know how we love sweets, even the bacteria, the fungus, the trichomonas also love sweets. So the more the diabetic you are or the more abnormal your sugar levels are, you are more prone for this vaginal infections. Even thyroid can also lead to repeated vaginal infections because thyroid is the main gland which controls most of the reproductive hormones in females. So this can also lead to vaginal infections. The other condition is when a male partner is diabetic, he'll also be more prone for infections. So when you have sexual intercourse, the chances of it getting transmitted from a male partner is also very, very high. So when we talk about this vaginal infections, the infection can be bacterial, it can be fungal, it can be trichomonas. What is this trichomonas? It is nothing but a protozoan or a parasite which is dependent on someone else for its growth. Last but not the least, the perimenopausal or the menopausal ladies who suffer with this vaginal infections. So when should you consult your gynecologist when you have this vaginal infection? As I told you, some amount of vaginal discharge is really normal in all women. So you should know when you should be consulting your gynecologist. When your discharge increases both in amount as well as the consistency, the change in the consistency, a simple thin discharge which becomes thick, when it can also turn curdy discharge, curdy white discharge, which is more common in fungal vaginal infections. When it starts itching, when it causes severe rashes, when it is associated with fever, and when you are pregnant, when you're already having an existing medical condition like diabetes, that is where you need to consult your gynecologist at the earliest to prevent it from spreading further. So normally when you visit your gynecologist with complaints of vaginal infections, what we usually do is we take a complete detailed history. Since when you have been suffering this vaginal infections, how did it start? Initially, how was the discharge, and is there any change in the color, the consistency or odor? Any history of travel also matters. Let me tell you, in women, the distance between the urethra and the vagina is very, very less. So even a urine infection can mimic a vaginal infection. So we also take a travel history, usage of common bathrooms, especially when we are working in office and we have been sharing the bathrooms with male employees, male colleagues, also can trigger a vaginal infection. So this history will also be taken, and we will be doing a complete pelvic examination where we observe the vaginal area, check for any rash, collect any discharge material for testing and send it for testing. Depending on what is the test, whether it is a bacterial infection, an yeast infection or a trichomonas, we give you the treatment. If it's a simple bacterial infection, you'll be treated with antibiotics. If it's an yeast infection or a fungus infection, you'll be treated with antifungals. If it is a trichomonas, which as I told you is a protozoan parasite, you will be given a combination of antifungals with antimicrobials. Last but not the least, as I told you, even a perimenopausal lady can also present with vaginal infections. This happens when there is completely shrinkage of your vaginal tissues. So in such cases, to bring back the moisture, to bring back the elasticity, we suggest you estrogen creams and estrogen tablets. So these are the common methods of treating simple vaginal infections. At the same time, in spite of treating, if again the vaginal infections reoccur, it is a common thing to treat the male partner also. Because as I already told you, a male partner can also transmit the infection to a woman. So this is all about vaginal infections, and the most commonest vaginal infections what we women come across is yeast infections. To know more about this, you can check out the link which is shared below and get a complete information about vaginal yeast infections. Thank you.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.